my name is Sonia Das and welcome to yet another episode of Medibiz TV Presents Talk Show with the Masters. Medibiz TV started as the world's first global healthcare online TV channel and is the sister concern of Aries Group of companies. Today at our corporate office studio, we are joined by two esteemed personalities as our guests for the talk show. Firstly, I would like to introduce Dr. Malathi A. She is the Group Chief Quality Officer and Group Chief Medical Officer at Aster DM Healthcare. She has 2 decades of experience in the healthcare industry and holds a bachelor's degree in medicine and surgery from Bangalore University and a master's degree in human physiology from Bombay University. She has also completed a training program in hospital administration from the Tata Institute of Social Sciences. She is experienced in the field of healthcare. Prior to joining Dr. Mupan's Healthcare Management Services LLC, she has worked at Fortis Hospitals Limited, Manipal Healthcare Enterprises Private Limited and Lokmanya Tilak Municipal Medical College. Let's welcome Dr. Malathi. Welcome.
Thank you very much, Sonia. Thank you.
Next, I would like to introduce Dr. Vinita Lutra. He is the quality head at Dr. Sulaiman Al Habib Hospital with more than 31 years of experience in the healthcare industry. He has worked at Batra, Max and Fortis Hospitals as Head of Medical Services in Delhi before coming to UAE. Dr. Vineet is a specialist in orthopedics and has completed his MBA in Hospital Administration. Dr. Vineet was previously the Operations and Medical Director at Lifecare Hospital, Musaffa. Let's welcome Dr. Vineet. Welcome, Doctor.
Thank you, Sonia, for being with us.
Our topic for today's talk show is the future of standards, technology, auditing, accreditation and revisions. Quality healthcare is more than just a popular phrase. As the transition to value-based care moves forward, the focus in patient care is shifting to quality and away from quantity. Healthcare outcomes for the patient are more important for the independent physician than the number of patients seen during the day. Given that quality has become such a key factor in healthcare, what exactly does it mean to provide quality healthcare? Let's speak to the experts. This brings me to my first question to you, Dr. Malathi. Why is it important for an organization, especially in the healthcare sector, to be accredited?
Great. That's a very, very important question, Sonia. And let me start by saying that when you say accreditation, I'd like to define what does this accreditation really mean so that we can understand the importance of accreditation. Accreditation is a process which is a self-assessment, and also it involves what is called as an external peer assessment. This would mean that the external review looks at what are the processes, the protocols and the policies in the healthcare provider, and that is compared against set standards. All in all, when we say accreditation, it actually is a very, very holistic approach, and in that it looks at quality assurance, it looks at what are your standards of practice, particularly are you having what is called as an evidence-based practice. It looks at what are your safety standards, what is ethics in medical practice. It also culminates finally into what we call as quality of care and patient safety. During this accreditation, the concerned bodies check whether these are in place and how much are you deviating, or is there what we call as a non-compliance or gaps in the service that you provide. So it is an eye-opener and a learning for the healthcare provider to put systems into place, and that leads to what we call as a continuous quality improvement. That's the purpose of having an accreditation. So it is external pair of eyes judging you, are you on the right track in the delivery of care. So it forms a very key aspect of healthcare systems.
And which brings me to the second question, Dr. Vineet. What are the benefits of being accredited by a top body in the country?
It is multifactorial. Actually speaking, it streamlines the operation. It gives an opportunity of identifying the risks. Now, when you identify the risks, you need to prioritize, mitigate, because any clinical risk to a patient leads a patient safety as a question. Now, nowadays, the acceptance of patient safety has a very low threshold. So our focus is always on patient safety. So it streamlines the operations. It also gives trust amongst the patient. And the other thing which I think is when we are living in a society of insurance, the insurance companies have trust and confidence that we are giving high quality care. So here it lies the processes which gives an opportunity for the staff, for the patient, and for external bodies to have faith on it. And more so, giving an example, suppose a visitor comes to Dubai, which is visited very frequently as a visitor. Now he unfortunately falls sick. Now where would he go? Now he would look into accredited hospitals because he knows the listed accredited hospitals have quality care. And once he goes into any of the websites, he finds, so he walks directly without inhibition with the confidence that yes, I'm going to the right direction. That's the advantage of getting accredited.
And anything to add to what Dr.
I think I totally echo whatever Dr. Vineet has said, and I think the most important point that he brought out is the trust. It is trust from anybody who avails the services. And also, secondly, I would only add another point that's saying that the people who work in an accredited institution, they have something to look forward to. There is a great level of satisfaction because they believe that they are providing the best to the people whom they serve, and needless to say, that is our patients. So I think that's where accreditation takes you to.
Dr. Malathi, what are the standard auditing and accreditation systems to be followed in UAE?
Firstly, let me tell you that we are blessed that in a place like the UAE, they believe a lot in quality standards being implemented. And therefore, there is an opportunity for various accreditation bodies to actually bring in systems into the hospitals here. Starting off with the Dubai Health Authority themselves, they have established standards and auditing process. So that means at your parent organizations itself, you have the opportunity to have the various hospitals accredited by them. Even then, we also are open to various others accreditation bodies like the Joint Commission International Accreditation, the JCI, which is very well known in this part of the country. In addition, we have the Accreditation Canada, which is called the Q-Mentum, and many of the hospitals go in for that as well. You also have accreditations which are done by the American Association, which is available. You have the Australian Council of Healthcare Accreditation, which is also what is called as EQUIP. The hospitals can choose the body that they would like to be accredited, which means there is a choice. There is never that you have to choose only one or the other. It is totally left to the organization to get ready for an accreditation, because at the end of it, it is just checking your standards, identifying gaps, go in for improvement. So you could choose the body that you want.
I would fully agree with Dr. Malti, and to say that she has given various platforms of international accreditation. And again, as she says, Dubai, we are fortunate to be in UAE where different local bodies also take care to inspect the hospitals to set a basic and high advanced standards. Now, when those standards are set and they come and scrutinize us, gives us a platform to look for a higher accreditation or an equivalent. So our internal accreditation bodies for all the Emirates gives us an opportunity to go a step ahead. Again, the patient safety and quality becomes the priority, and that's what we're looking for.
But each emirate, just out of curiosity, but each emirate having its own accreditation system, I believe, isn't it a bit, I don't know, isn't it a bit complicated, because you have to get it in each emirate and then, you know, have an international accreditation as well.
You're right in one way, I agree with you, but different emirates have their own bodies, but actually speaking, their whole goal and aim is one: patient safety. They go by the name of Ministry of Health in the Northern Emirates, they go by DHA, they go by DHCC, and they go by Abu Dhabi's HAD, which is now changed into a different modality, but the standards are the same. Now this brings to us a point where they have different standards, but they are focusing on one way or the other, different ways of reaching the same place. The numbers would change, the titles would change, but the intent would not. And that's the quality.
Okay. So, does being accredited from a top body ensure quality for the patient, Dr. Vineet?
Absolutely. It shows that your outcomes are better, you have a path, and there is an interactive session, engagement, patient engagement. Now we're talking of two. When we say a quality, it does not mean a definition. Quality also means what is patient expecting as quality. So we imbibe the requirement of quality from the patient's perspective to give the best, and we do have standard at our back to take that into a different level. So it improves outcome, decreases errors, gives a different direction for performing differently. The accreditation bodies don't say we come for fault finding, they come for fact finding. Now when they say fact finding, then the chances of improvement are there, and that gives us as the hospital to go for the next things to be done differently, and that gives a better outcome.
Okay, anything to add to Dr.
Absolutely. What happens is these are accreditations which happen at regular intervals of time. And we always believe that when you go into the next accreditation, which is called the re-accreditation, you raise your bar. The accreditation bodies also, when they start the accreditation to begin with, would like you to have the systems in place. The next accreditation, they believe that you already are a matured organization. And I have seen this out of experience because a number of my hospitals are re-accredited several times, the third time and the fourth time. And every time it's an experience by itself, because we find that we are raising the bar, which simply means I'm trying to put in much stronger and robust systems in terms of delivery of quality of care and patient safety. So I would call it as a learning. And as I always say, quality is always a journey and never a destination. And therefore, we move along and keep learning at every accreditation. What is it that we can do better? Secondly, I always believe that for my group of people, it's a learning. When they face the surveyors or the auditors for that matter, they learn much more than what they would have done if we were in a cocoon and not exposed to what I call as the external pair of eyes. So that's what I said we derive basically from this process.
Taking a cue from her word journey, when she said accreditation and re-accreditation. The journey is that you embark on a journey to achieve initial accreditation. Now that's a sense of achievement. You have achieved something. Now how do you sustain? That's the time re-accreditation checks you. Have you sustained what you achieved? And it's not about getting a certification, that's a paper. It's how you have implemented what you have achieved and how you have gone into the systems to disperse it to your staff. For example, the staff may say, okay, get ready for an accreditation, but we are not looking for that. We are looking for the patient. This gives a via media to go for the patient and outreach for them. That gives a better outcome, better understanding, and when quality becomes habit, it becomes a hobby. And hobby, nobody is a person who does not like to have a hobby. So make it inside yourself, make it a hobby, you'll love doing it.
Great. But doesn't it put pressure on the employees? I mean, to reach that level of, say, to be at the highest standard or to be the number one?
Very well said. A wonderful question, because very often this is put across to me. And when they say that, how have your own people in the hospital taken it? The way we have to put forth, as rightly put forth by Dr. Vineet, is we never start by saying we want the gold seal on the wall or we want this plaque on the wall. We always start with the people saying that, what is it that you want to do good for the people whom you serve? And it's very simple. It is the delivery of care and safety. So we say that let's work towards it. And how do you work towards it is simple. You put in systems, processes. So much so, when they get used to it, as said by the word habit, they find it very difficult now when we deviate from it. And they do feel that, why is it that the system is not working? Because the idea of the entire process is you become system dependent and not individual dependent. The moment you become individual dependent, it means there could be errors. It could also mean if that person moves away for some reason from that particular seat, the whole system can collapse. But now it does not happen. The third very important is it teaches a lot of empowerment. People know exactly what is expected of me, how much is the decision I can take, because these are all the processes that you follow. So the whole system becomes a very well-oiled system. And who does not like to work in an environment which moves very smoothly? You find you have more time to focus on many other things which might have been an absolute firefighting. There could be a lot of crisis that you decide, now what do I do? Now that doesn't happen, because you know, okay, this is what it is, and I proactively, which was answered by Vineet beautifully by saying, we manage risks. We proactively come to know what could go wrong, and therefore I am very well built to prevent it from happening. So which means in the end, if you look at it, you need to inculcate this in them, which is what I believe is the creating the awareness, taking them and holding hands with them as you pass through the journey, and then when you reach the goal, you wait and watch the absolute euphoria that your patients get is one, more importantly your own employees. And they have made it a habit that they wait and they say, we never say that accreditation is due, are we getting ready? All of us feel, yes, we are all ready. I say that every day is a day of accreditation. And that's what happens with the whole process, and they don't feel that. Yes, initially, yes, it is a challenge. We ought to believe in that and believe that people have to be taken with you. Once you've achieved, you don't turn back.
Taking from people taking with you, there's a saying, what is the difference between a boss and a leader?
Yes.
Boss says do it, leader says let's do it. Now that's, at Sulaiman and Habib, we take that particular punchline. What we try to do is, for example, if I have to take chapters of accreditation for the clinical side, I would take one doctor for each chapter. I would say, let's do it together. Now, he would understand the clinical part much better than a non-clinical person. So I involve him, I sit with him. When I say I, my team also is with me. And we discuss all the accreditation processes. And then this person starts understanding, wants more and more. And then we ask him to present it before the staff. Now, when a physician is presenting before the hospital staff, that shows the involvement, that shows the honesty, that shows the dedication. It does not mean we are forcing, it means that we are involving. And when they involve voluntarily, it is never done by force. It becomes a part of their continuous journey. And she rightly said, it's a journey, it can never stop. It's a stepping stone to the next level.
Doctor, next question would be to you, Dr. Malathi. Dubai medical sector is growing day by day, and so are the services that each organization offers. What are the various services you provide in your organization?
To put in simple terms, we at Aster DM believe that the services should be accessible and it should be affordable. Now, if having said these two words, how do we achieve that? It would mean that we provide a full array or gamut of services, which by and large we would like to have it under one roof, which means when my patient comes into my hospital, I can get the array of services that I require to a very large extent. Secondly, affordability could be an issue. So at Aster DM, we have hospitals which are called as the Aster group of hospitals. We also have what is called as the Access group of hospitals. We have a third, which is called the Medcare group of hospitals. Now, each one of them caters to a different sect of the community. But having said that, what we try to aim is that the standard of care remains the same. So there's no compromise in terms of the quality of care or the safety, but at the same time, we are achieving what we want to do, and that is serve the community at large and provide them to all the sects of the community, and they are all available under one roof. That starts anywhere from a primary care, because we have over about 50 medical centers, which we call the Aster primary care. So you have primary care, you also have secondary care, you have tertiary care, and take it a step further. We make sure we go further to the homes and we deliver home care. So there is a continuity which starts, which we call it as a patient journey. And that means we give the services across to everybody across the community, starting off from primary and ending up at the level of a tertiary or a quaternary care. So that's the area of services we provide.
I would state that as unity in diversity, because she has different levels, their hospital has different levels. Addition to what she's saying, and she's catering to the population which have access, which don't have access, Some specialized care which we are providing in Sulaiman Habib are also recognized. We got Innovative Healthcare Excellence Awards, and that is epilepsy surgery. In the private sector, we are the only one who are doing epilepsy surgery. To give you an example, a child, 3-year-old child from birth, having 30 fits per day since 3 years. Our neurosurgeon, we do live mapping when open the brain and electrodes live in the time of surgery to pinpoint where is the focus of the fits and epilepsy. And we remove that part of the brain. Now this child, 3 years, 30 per day, after operation he stayed with us for 15 days, no fits at all. So that's the kind of tertiary care we are providing. Of course, as she said, home care, we also have a home care services where access is not possible or a post-discharge patient needs a care. We extend those services. We have ambulatory care. And for us, we have a tertiary care in terms of NICU is tertiary care. We have the tertiary transport ventilators. We have the HBO. We have the third level NICU services. ICU is tertiary care managed by consultants 24 hours, all levels, pediatric ICU. So the services are diverse, starting from outpatient to inpatient to surgical level. Anesthesia level is newborn patients, also child, also we give anesthesia. We have those level of anesthetists available. So to say, giving the best, which Dubai wants it, UAE wants it, we provide it.
I believe that's what makes UAE or Dubai one of the most visited
So
or
Yeah.
by all over the
And if I may add and take it from that, it would also mean that we at large hospitals like ours, which give a whole lot of gamut of these services, the big advantage that we have is our sister hospitals, which we also have back in India. But we always make sure if there is a patient who requires a very high-end surgery where we need a technical expertise, we would make sure that we fly down our concerned person who comes down here and makes it sure the patient gets what he needs. And that is the best resource, what we say as very, very high intellectual minds working together, because at the end of the day, we want this patient to get what he needs and go home happy, because the promise that we have at Aster DM is we'll treat you well. So going ahead with that, we'll treat you well, applies to not only our employees, we are particular, we treat them well, but we always say every patient walking into the hospital, we ensure you will treat you well. Services could be available in our own hospital, but if not, we make sure we get them from India and the person is available here. So that's how I think as hospitals, we make sure we have the complete array.
Does quality also mean more money? Does it more expensive? Because that's what I think any person would even think, that visiting such a big hospital, like, oh, is it going to be expensive? Even with insurance, would it be too much of a money involved that we have to go back to our own home country to do it? So does that mean, expense as well?
You have touched a very sensitive topic. I do agree with you. Quality does not cost. Quality brings processes. And if processes are robust and you give a very good outcome, the people are ready to put money for that. So we are not saying quality is costly. Quality is very process outcome oriented, and it's not a tangible direct, intangible in a indirect way. It will give you returns in a longer term. So it's a long-term planning. Short-term plan cannot be a quality. It's an instant reaction to a proactive, changing into a proactive. As I said, risk management is proactive. You mitigate it. The person who enters the organization, we believe that the quality is not giving when the patient is there. The quality is, we have a motto, from doorstep to bedside, which means when a patient enters the doorstep, the first encounter is by valet parking. Now, if this valet parking is quality oriented, he would be very smiling, welcoming, and the patient gets so happy, oh my God, I've reached the right place. He goes to the next step, he encounters the registration, if they are also welcoming. So at all steps, if they are good till the bedside, it is again a journey. Now, it can be one thing that if at the reception, the person is not giving interest. So what happens? He or she has not spoiled that particular moment. He has spoiled all the past actions. So the start has to be good, the continuation has to be equal. As you say, clinical care standard throughout is also other care standard throughout, which makes them understand, well, am I investing in the right place? Yes. When you encounter this, they will say, yes, we must go there back because they take care holistically, entry to exit.
I just would add only 2 points because I summarized it beautifully by Dr. Vineet, and that is, if you look at quality, what does it look like? It is all about efficiency. That's what Vineet means by saying putting processes into place. When you're more efficient, your productivity is much better. That's what comes under, we have various projects which are put in place, which we call it as the lean management projects. The idea about this is, are we wasting a lot of time of a patient going crisscross to various areas, which probably could have been at one particular point? We would realize, and it has been out of experience, that when we realized a patient would move in at the admission, come back to the next for an insurance, a third place to find out the bill, fourth place to go and pay that again, and then come back all the way back again to say what has happened. Now, all of these could be cut short by just understanding where is it that we can cut down. Maybe the same person could handle it, which is what comes under the lean management. And what did we achieve? At the end of all of this is, this patient is so happy that I could finish whatever needs to be done at the 2 stops and I'm out of it. So what are we aiming at is just that single word. Am I delighting my customer? We no longer talk about customer satisfaction. Satisfaction is sort of something that you have to provide. That's the norm. That's why when I say that, when somebody tells me in my hospital, the patient was very satisfied, I always say that that's what it is supposed to be. What are we so happy about? What is it that you have done different? Is what I say is, did you understand the pulse of your customer? Which means, did you delight the customer? Because once you delight a customer, he or she always believes you and only you will be there for me and for my family. So I think that's what quality actually does. So it's not the cost factor, but what you see as an outcome. Your number of errors you make become much lesser, because if you have an error in the healthcare system, it's going to be extremely difficult on all the outcomes that can happen out of that, starting off with your medical, legal, so on and so forth, and finally for the patient. But if you have a system, a proper evidence-based practice, your errors become less. So what did you gain from all of this? You have actually cut down the cost, both through your patient as well as to the organization. And that's why we say is cost and quality, rightly said, is very, very important to look at it from a true perspective. And then you look at the outcome. Because your infection control, if you have a patient walking in and lands up with an infection, you're going to increase the cost to, first of all, the patient. But if you put in a system, you automatically make sure the patient doesn't suffer, has no infection, length of stay is less, he walks out to the hospital. So what is it all about? You didn't entail a cost at all. And that's what, finally, the end of the day, what is important is you make the system efficient.
And she rightly said that eliminating the unnecessary, which she says lean, that's a part of Six Sigma. Lean Six Sigma, which says eliminate waste. Once you eliminate waste by your processes, which is improvement processes, which normally we all have a common PDCA project, which is plan, do, check and act. It gives an insight of where are we wasting time, resources and cost. So that leads you to eliminate that waste, leads to efficiency and a good outcome and cost reduction. And that's what we call as project management.